Welcome to Assembly Health and Human Services. And we are meeting early, and I appreciate everybody be accommodating the earlier schedule so we can try and get folks home before this weather strikes. We are getting into crunch time with member bills, so we're trying to move things quickly and efficiently, and I appreciate everybody who's willing to be here today. Will the secretary please call the roll?
Assemblywoman Gonzalez. Assemblywoman Gorlow. Here. Assemblyman Gray. Glad to be here. Assemblyman Hafen. Assemblyman Hibbets. Assemblyman Koenig. Here. Assemblywoman Newby. Here. Assemblyman Wynn. Here. Assemblyman Orenlicker. Assemblywoman Taylor. Present. Assemblywoman Thomas. Here. Chair Peters.
And I am here. Please mark other folks in attendance when they arrive. A couple of housekeeping items. Just please remember to turn off the sound on your computers and phones so we're not interrupting speakers. Members of the public may provide testimony in a variety of ways, all of which are listed on the agenda. You may also submit public comment in writing, either in addition to testimony or in lieu thereof. Written public testimony may be submitted before, during, or up to 24 hours after the meeting's adjournment. If you wish to testify in person, please sign in at the table by the door and leave your business card so we get an appropriate record of your name. If you do not testify, you may also want to sign in so that we have your contact information if you are interested in these particular items. To ensure an orderly flow of discussion, all comments, questions, and responses must go through me. I appreciate it. Committee members waiting to be recognized by me before you can speak. Additionally, I ask our presenters on Zoom to leave your cameras off and microphones muted until it's your turn, and or I direct a question to you. When testifying in person, please turn the microphone on to speak and off to listen so we avoid any reverb. With that, we'll move on to our agenda. We are taking the bills out of order today. I'm going to go ahead and open the hearing on Assembly Bill 178, which revises provisions governing emergency medical services. I would invite the presenters to come up to the table. I don't believe you have anyone on Zoom, but just want to check in. Great. Please remember to state your name for the record. You may proceed when you're ready.
My introductions this morning say good afternoon, Chair Peters, and members of the committee, so I'll fix it. Good morning, and thank you, Chair Peters. I like getting this out of the way. That isn't exactly what I meant, but it is Friday, and anyway. For the record, I'm Assemblyman Burt Gurr. I represent the vast open spaces of Assembly District 33, which according to legal the other day is somewhere north of 50,000 square miles. I want to thank you for the opportunity to present AB 178. I introduced this bill after hearing from my constituent MedX Air 1 and the administrative burden that renewing their annual license has on the organization. Simply put, AB 178 changes the requirement that operators of ambulances, air ambulances, or vehicles of firefighting agencies renew their state license from every year to every 5 years. I have not been contacted by anyone that opposes this bill. With that, I'd like to turn the presentation over to Jake Dahlstra from MedX and Tom Clark to further explain the bill and to offer an amendment. Thank you.
Good morning. My name is Jacob Dahlstra. I'm the EMS director with MedX Air 1, and I wanted to thank Chairwoman Peters for allowing us to testify here today and other members of the committee. So MedX Air 1 is a ground and air ambulance provider, primarily in northern Nevada. We have our beginnings started in 2015 in Winnemucca at HGH. We partnered with that hospital, placed a helicopter there. And then in 2016, we placed a helicopter in Elko, and then expanded in 2019 into Ely. And then in 2019, we started providing ground services in Elko. And then today, we have, we're an Intermountain company. So Intermountain Healthcare out of Salt Lake purchased our company, and we are an Intermountain Healthcare company. We have 5 air assets and 5 ground ambulances throughout northern Nevada. Our service area, we cover Elko County, Eureka County, Humboldt County, Lander County, Pershing County, and White Pine County. So our current process is we have to get licensed by the state EMS office every year. And what that means is the state EMS office will send representatives out to our organization, and they will go through our ground ambulances, they'll go through our air assets, and then make sure our program as a whole is meeting the requirements. Why are we asking for a change? We're asking for a change because we believe that doing this on an annual basis creates a lot of unnecessary administrative burden, and there's a lot of smaller EMS agencies or volunteer agencies that just don't have the administrative support to be able to do this on an annual basis, and it creates a lot of extra work for those smaller agencies. We also believe that this change will decrease the amount of workload for the EMS office themselves. They're a great group of people, very dedicated office, and they're great to work with, but they are understaffed, and we believe that this will reduce some of their workload so they can focus on other issues that their office faces. We've been talking with some of our neighbors, and we have support. We have not talked to any fire department or EMS agency that opposes this bill. We've been in contact with Linda Bingaman. She's the fire chief for Carlin Fire. They're supportive. They're a smaller volunteer agency within Elko County. Chris McCann, he's the EMS director for Elko County EMS. He's supportive, and Mike Harris is the EMS director out in Lander County. He's also supportive. We've also been talking with Drew from HGH EMS, and he's also supportive. And so we have a lot of support for this bill, and we appreciate your consideration on it.
Thank you, Madam Chair, members of the committee. For the record, my name is Tom Clark, here on behalf of Medics Air 1. I want to thank Assemblyman Gurr for bringing forward this piece of legislation, and since it's Friday, I can tell a fun story. When Mr. Gurr first came to my office in Reno as a candidate, we were sitting across the table from each other, and I was telling him about my Elko roots, and he looked at me and said, "You're Lucky Clark's kid." And I said, "Yes, I am." And turns out Mr. Gurr and my dad went to high school together. So there's Nevada is a small town. It just reiterates that all the time. And he's been telling me great stories that my dad would never tell me, so that's fantastic. My job today is to walk you quickly through the bill and the amendment that we will present. The meat of the bill is in section 1, sub 6. It's line 28 on page 2. All permits expire. We're removing the July 1st deadline, 5 years following the date of issue, and are renewable each 5th year thereafter. The amendment that is up on Nellis and that we propose today changes that from 5 years to 2. That really is an outcome of the feedback and having conversations with other stakeholders. 5 years seemed too many. We settled on 2 because doing this initially at a every other year process, I think will put the providers in a really good space. Section 7, sub 7 of section 1, basically states that if there is a change of ownership or operator within the system, they notify EMS, state EMS, within 90 days. One of the questions that I did receive from Clark County is that, just to clarify for the record, that that's intended mostly for the private carriers. If you're a fire department, volunteer fire department, a state agency that gets this license, you won't need to send a notice to state EMS every time there's an election, every time there's a new chief, every time there's some new quote-unquote operator of that system. So this particular section is intended so that if a new buyer comes in and purchases MedX or one of the other companies, and there's a whole new team running the show, they need to notify state EMS so that they can then trigger that requirement that they renew their license at that time. And then on section 2, starting on line 31 of page 3, the way that we envisioned this working, and I did not provide in the amendment, and I will clarify it, because the last line, 35, still says 5 years. I didn't put that in the amendment. That should be changed to 2. So the intent here is that Medex Air 1 and others, they all renew this July 1st. That renewal will be for 1 year, even if this bill passes. And then in 2024, when they renew, it will be for the 2 years. So it's not a, immediately if this bill passes or when this bill passes. It's not at the time of passage. It simply states, we're not going to disrupt the state EMS office right out of the gate. Let's do our renewals. We'll come back in 12 months, renew again, and when that renewal occurs, that will be for the period of 2 years. So I think that will make some changes to the fiscal note and the impact that it has on the state EMS office. I will tell you that Mr. Dahlstra did have a conversation with the chief investigator, the person that he works closely with state EMS. We didn't want them to have any surprises with this particular piece of legislation either. So that pretty much outlines the feedback that I've received on the legislation. The amendment is there, and all of us would be open to answering any questions, Madam Chair, if there are any.
Thank you so much for the presentation and for that amendment. I believe everybody has a copy of that because we've been having internet issues, I've had to walk back my preference to not print materials for everybody. We have these binders provided by staff that have all the documents, exhibits that we would find online for you, just in case we lose that internet. But the amendment is in here. We've made a note to update that section. If you could provide just an email to staff that confirms that you'd like to amend section 2, that would be great.
Thank you, Madam Chair. Tom Clark, for the record, we will do that.
Perfect.
Absolutely.
Are there any questions from the committee? Yes, Assemblywoman Taylor.
Thank you, Madam Chair, and to my colleague and those who are here. Thank you for bringing this forward. Just clarity, and it's in the amendment, but I've just had an opportunity to read it now due to aforementioned internet issues. So we're changing it from 5 years to 2 years. And that's basically, in a nutshell, what we're doing with that amendment. And it starts not when they renew in 2023, but when they renew in 2024.
For the record, Tom Clark, Ms. Taylor, you're absolutely correct.
Okay? Thank you so much. Thank you, Chair.
Thank you for that clarifying question. I have Assemblyman Gray next, and then Hibbets after that.
Thank you, gentlemen, and Assemblyman Gurr for bringing this forward. This has been a regular issue in our community, and I've talked to my fire chief on it and the other agencies. And I appreciate you guys rolling it back. I think 3 years for me would have been the sweet spot, and it does, not only does it reduce the burden on agencies and you guys as well, but also reduces the burden on the state, reduces costs in the long run. I mean, annually is kind of, I think it's just an arbitrary period. They picked it at one point. But I know we've had inspectors show up, and for one reason or another, I won't go into, they couldn't complete the inspection. And we now have ambulances that are basically not permitted working the streets because we don't have any other way to do it. And they've been trying to get it rescheduled, but the resources are so limited that they can't get back out to inspect that. So this was a great one. I was very honored to co-sponsor it with Bert, and I'm really hoping the committee and the entire assembly sees the value in this bill for our public. Thank you.
Thank you for that comment. Assemblyman Hibbets.
Thank you, Chair. I just want to clarify that the intent of this is not to double the fee every 2 years, or in the original version, times it by 5 every 5 years, correct? Because it's not addressed in the bill itself, it doesn't change the fee, or would that be addressed in the administrative code?
For the record, Tom Clark, may I go direct, Madam Chair, to Mr. Hibbets? Thank you for the question. That is exactly right, that there is no increase in the amount of fee that will be collected every 2 years versus every single year. So when you look at the fiscal note, there will actually be a decrease in revenue to the department. And going back to Mr. Gray's question, that was one of the reasons that we fell on the 2 years, is so that we didn't have such a negative impact with all of the, I believe there's 68 providers that are licensed through the state EMS office, that we didn't have as much of an economic impact on them. Therefore, yes, every 2 years they'll pay the same E as if it was for 1 year. Thank you.
Thank you very much. Thank you, Chair.
Thank you for the question. Are there other questions from the committee members? Assemblywoman Gonzalez.
Thank you so much, Madam Chair. Good, what is it, afternoon, morning? We normally have this committee in the afternoon. Thank you so much for the presentation. My question is about the maintenance of this equipment and the lifespan. If you could maybe go into that a little bit. Thank you so much.
So thank you for your question. For the record, Jacob Dalser with MedX Air 1. Madam Chairman, can I go direct to Ms. Gonzalez?
Please feel free to go direct to the members.
So it's a good question, and it's a difficult question to answer. I think every agency probably has a different maintenance program for their vehicles. Our goal is to maintain our vehicles so they're response ready. When somebody dials 911, they're ready to respond. And I would say that every 68 agencies that are licensed with the state of Nevada share that same common goal. But how they maintain them, there's a lot of variables to that. For instance, in our program, we do a lot of long-range transports. So transporting patients from the hospital in Elko to Salt Lake to Reno to Las Vegas. And so that puts a lot of road miles on our vehicles. And so our vehicles may need to be replaced sooner than a fire department that just transports within the city. And so, and then aircraft are completely different. They're regulated by the FAA, and they have required maintenance on so many hours on the aircraft. Every 50 hours, 100 hours, 500 hours, they have to do regularly scheduled, maintained maintenance on them, and that's, again, regulated by the FAA. And so I hope that answers your question. I don't have an exact mileage or exact year of how long these vehicles will last, because it does vary from department to department.
Thank you for the question. Are there any other questions
Madam
from?
Chair,
Yes,
could I add to that just a
please,
little bit?
Assemblyman Gur.
Almost 100 years ago, but, well, maybe not. I was on a fire crew in Elko on a BLM, and we maintained our equipment every day. I mean, you didn't know where you were going to go, when you were going to go, so you had to have it road ready, fire ready. And I can't imagine these guys not doing that. Just a comment. Thank you.
Yeah, Assemblyman Gray.
Thank you, Madam Chair. As a co-sponsor of the bill, I'd just kind of like to add also, especially having an EMS background, the focus of a big part of this inspection is also not so much the maintenance of the vehicles, it's the, are the narcotics, are they ready to be used? Are they properly secured? Is all the equipment, the life-saving equipment, is that ready? Make sure nothing's expired. So that's where it's really important to the public, because with maintenance with vehicles, I can't tell you how many ambulances I've been in that have just died in an intersection. So, but it's the life-saving stuff that's the really important stuff. So, and I think the 2 years captures that perfectly.
Thank you for that comment. I had this similar concerns about just making sure that people were keeping track of their stuff. It's as a mom, I have to check that my kids are cleaning their rooms. And I think sometimes regulation is a little bit like that it keeps everybody thinking about what is the purpose and what is my job. And it can get a little chaotic for you guys. We know it's not an easy peasy job out there. You guys have a lot going on. So I have to agree. I think 2 years is a nice compromise. Was concerned about the 5 years. I know we're not a fiscal committee, but I do want to just bring note to the fiscal note. I assume that you're chatting with the agency on that fiscal note and looking at with the amendment to see how much can be absorbed or what that cost overall will be to them.
Thank you, Madam Chair. Tom Clark for the record. Absolutely, we will work with them to recognize, and I want to make sure that they clearly understand the language in Section 2 about the effective date and how it's not going to affect them fiscally this year, but next year, and then the 2-year impact instead of the 5-year impact. So yes, we will be working with our friends. And while I have the microphone, I want to thank you for being flexible on this scheduling. This has been a rough week for everybody in the EMS industry. And so for you to have some, give on the date and the time to do it on Friday so that we could, recognize the folks that we lost on Wednesday, we very much appreciate that. It has had an impact on EMS across the state.
And we appreciate that comment. I wish that more of us could have made it to that event, but our hearts were there with y'all. And we did offer a moment of silence to reflect on the lives lost, and this, and always just want to express our appreciation for the work that you all do. First responders are really, really out there doing the work. Are there other comments, questions from the committee before we move on to testimony? Seeing none, thank you so much. We'll go ahead and move into support testimony on Assembly Bill 178. Are there folks in Carson City? We're doing this a little bit differently. I'm no longer maintaining a rule about how we do public comment. I will have my discretion on the number of folks per meeting, and how we'll manage those on our time schedules. Today, I have no 2-minute limit, but we do ask that you maintain a sense of decorum and politeness in testimony. I will go ahead and open support testimony today here in Carson City. Seeing no one coming up to the table, we'll go to Las Vegas. Is there anyone in Las Vegas who would like to provide support testimony on Assembly Bill 178? Seeing none. BPS, is there anyone on the call-in line who would like to provide support testimony on Assembly Bill 178?
If you'd like to testify in support of Assembly Bill 178, please press star 9 now to take your place in the queue. If you would like to testify in support of Assembly Bill 178, press star 9 now. Chair, there are no callers choosing to testify at this time.
Thank you so much. We'll go ahead and move into opposition testimony on Assembly Bill 178. We'll start in our physical locations and then go to the phones. Is there anybody in Carson City who'd like to provide opposition testimony on Assembly Bill 178? Seeing none, is there anyone in Las Vegas who would like to provide opposition testimony on Assembly Bill 178? Seeing none, BPS, is there anyone on the public call-in line who would like to provide opposition testimony on Assembly Bill 178?
Callers, if you would like to testify in opposition to Assembly Bill 178, please press star 9 now to take your place in the queue. Again, if you'd like to testify in opposition to Assembly Bill 178, please press star 9. Chair, there are no callers choosing to testify at this time.
Thank you so much. We'll move into neutral testimony. Is there any neutral testimony in Carson City on Assembly Bill 178? Please remember to state your name for the record. You may begin when you're ready.
Thank you, Chair Peters, members of the committee, Bradley Mayer, representing Southern Nevada Health District. Just informationally, the Southern Nevada Health District actually is an agency that does regulate and license EMS providers in Southern Nevada. But this bill would have a very minimal impact on our operations, and we just wanted to make sure that you knew that and that we are neutral, barring any other amendments. Thank you.
Would you hold on for just a second? Are there any questions from the committee for the jurisdiction? Right. And this testimony is in light of the amendment as well, right?
Yeah, the amendment reduced the years only, so.
Perfect. All right. Thank you so much.
Thank you.
Is there anyone else in neutral testimony in Carson City? Is there anyone in Las Vegas who would like to provide neutral testimony on Assembly Bill 178? Seeing none, BPS, is there anyone on the public call-in line who would like to provide neutral testimony on Assembly Bill 178?
Callers, if you'd like to testify in neutral for Assembly Bill 178, please press star 9 now to take your place in the queue. Again, if you'd like to testify in neutral for Assembly Bill 178, please press star 9 now. Chair, there are no callers choosing to testify at this time.
Thank you so much. With that, I'd like to invite the bill sponsor for closing remarks. He's waiving his closing remarks, and we'll go ahead and close the hearing on Assembly Bill 178. Thank you again for being here and accommodating the schedule move. I believe we have everyone here for our next bill, Assembly Bill 167, which makes various changes relating to dementia. We will go ahead and open the hearing on Assembly Bill 167 and invite our sponsor to the table. Please remember to state your name for the record. You may begin when you're ready. Do we have someone on the Zoom as well? Yes. BPS, if we could pull up our presenter on Zoom. Oh, she's in the grants building.
Sure.
Sorry about that.
No worries, I was just going to let you know.
Thank you so much. I believe we have somebody in Las Vegas who is co-presenting today. If you are there, please feel free to come up to the table, and we will let you know when we are ready for you to offer your part or piece. That's not. We're looking for Amy Peterson. Amy Peterson. Sorry about that. Thank you, Ms. Peterson. Okay, I think we have everyone in their right spot. We can begin when we're ready.
Good morning, and good morning, Chair Peters and committee members. For the record, I am Assemblywoman Claire Thomas, representing Assembly District 17 in beautiful North Las Vegas. It is my pleasure to present to you Assembly Bill 167, which seeks to establish a dementia care specialist program in our state. Joining me today is Charles Duarte, Nevada Public Policy Director of the Alzheimer's Association. Before Mr. Duarte provides you with details to the bill, I would like to raise your awareness to a pressing issue that affects a growing number of older people in Nevada and across the country: dementia. Dementia is a debilitating disease that affects a person's memory, cognitive abilities, and daily functioning. It is estimated that there are currently about 6.5 million people living with dementia in the United States, and this number is projected to reach 14 million by 2060. In Nevada, the number of people living with dementia is also on the rise, and Mr. Duarte will give you the numbers in a bit. These statistics highlight the urgent need for us to take action to address this growing health crisis. We have a moral and ethical obligation to support and care for older people with dementia, who are often some of the most vulnerable members of our society. This support can take many forms, from providing adequate health care and social services to ensuring that people with dementia are treated with dignity and respect. One important way that we can improve dementia care in Nevada is by establishing a dementia care specialist program. This program would provide specialized training for healthcare professionals who work with people with dementia and their families, ensuring that they have the knowledge and skills to provide the best possible care. This program would also help to raise awareness of dementia and reduce stigma, which is often a barrier to people seeking help and support. Currently, there are only a handful of dementia care specialist programs in the United States, and none in Nevada. This is a significant gap in our health care system that needs to be addressed. By investing in dementia care specialist program in Nevada, we can improve the quality of life for people with dementia and their families, reduce the burden on caregivers, and ultimately improve the quality of lives for Nevadans suffering from this disease. A little personal history I would like to share. My mom passed in 2020, but before her journey, she was diagnosed with this terrible disease. We, her children, didn't realize that Mom was experiencing all we knew was that she was sometimes forgetful or extremely withdrawn. Her personality changed dramatically at times. She was docile, then there were times she became combative, angry, willful. Just to highlight what we noticed was her personality change. It became extremely alarming when Mom exhibited this violent behavior towards strangers. We hired caregivers to assist with her day-to-day living. Our mom was a warm, loving, kind, gentle person who taught us, her children, to have those attributes. My siblings and I regret we didn't know how to address or help Mom with this life-changing disease. I only share this because I know there are families in Nevada that need the assistance and education that we needed for our mommy. Now I will hand it over to Mr. Duarte, who will provide you with more details and an overview of Assembly Bill 167.
Thank you, Assemblywoman. Thank you, Assemblywoman Thomas. For the record, my name is Charles Duarte. I'm the Public Policy Director for the Alzheimer's Association in Nevada. And Chair Peters, I want to thank you for taking us out of order. I apologize I wasn't here at the start of the hearing, but I really do appreciate the opportunity to speak with you and the members of the committee today about Assembly Bill 167. On behalf of the more than 50,000 Nevadans who are living with dementia right now, their families and care partners, I'd like to thank again Assemblywoman Claire Thomas for sponsoring this bill, which establishes a dementia care specialist program in the state. As she mentioned, dementia is on the rise in Nevada. According to the 2021 Nevada Elders Count Report, the growth of the older population in Nevada continues to outpace the United States. From 2011 to 2018, Nevada experienced a 40% increase in people aged 65 and older as compared to 25% nationally. Additionally, the Alzheimer's Association estimates by 2025 there will be 64,000 people 65 and older living with Alzheimer's disease. That's the third fastest rate of growth of Alzheimer's disease in the nation, right behind Vermont and Arizona. According to studies of dementia crises, delusions, wandering, stealing, and hallucinations were key behaviors contributing to crises, especially when the behaviors present a risk to the individual or others. These crises are often the result of unmet needs, caregiver burnout, or interpersonal conflicts stemming from confusion and communication problems, are often avoidable given proper education, support, and a person and relationship-centered approach to caregiving. As the Assemblywoman mentioned, dementia is a life-changing and expensive condition. According to the association, Nevada Medicaid spent $203 million on enrollees with a dementia diagnosis in 2020, most of that in long-term care services. That number of Medicaid expenditures is expected to increase 36% by 2025. Studies also show that interventions like a dementia care specialist program can delay nursing home stays and avoid them altogether by supporting family care partners. Each day a person living with dementia stays safely at home and not in a nursing home saves Nevada Medicaid $265, and that's almost $97,000 per year per person. Behavioral crises predominantly happen in the moderate to late stages of dementia, where the catalyst for admission to a psychiatric hospital, a specialty unit in a hospital, long-term care settings, or referrals to psychiatric community services are precipitated by these crises. Few long-term care facilities are willing to take people with dementia who are in crisis. Additionally, few stabilization options exist, with emergency rooms and inpatient psychiatric hospitals serving as default receiving facilities. In both the 2022 Facts and Figures report from the Association and the 2021 Nevada Elders Count report, workforce and infrastructure are significant barriers for older adults in Nevada. This will have a disproportionate impact on people living with dementia and their family caregivers, causing further strain on Nevada's resources to support this vulnerable population. To better serve Nevadans, the Alzheimer's Association and the UNR Dementia Engagement, Education and Research Office and the UNR School of Public Health look to other states for solutions. I'm going to deviate a little bit and explain that Dr. Jennifer Carson, who works for the UNR DEAR program, she and I had opportunity to talk with first responders, county social workers, and other folks that were involved in the Northern Nevada Regional Behavioral Health Policy Board. And we heard from them directly about the kinds of crises that they encountered on an increasing basis with individuals who probably had dementia. They ended up being handcuffed, put in the back of a police vehicle, transported to a hospital emergency room, and oftentimes because of that trauma, with the addition of dementia, they end up in delusional states and oftentimes end up in psychiatric facilities and are discharged to nursing homes and rarely back to their own homes. So this is a growing and common feature that we see in terms of encounters increasingly involving individuals who have dementia. So we looked at other states, and the state of Wisconsin was highlighted as a state that had an excellent program. And so Dr. Carson and I contacted the Wisconsin Department of Health Services and learned more about their integrated approach to dementia response into their No Wrong Door Disability Resource Centers. And this was called the Dementia Care Specialist Program, or DCS program. It involved a three-prong approach: an initial crisis response, crisis stabilization, and then providing long-term care and support services for people living in the community who are exhibiting these challenging behaviors. In addition to crisis response, the DCS program also works proactively to support people living with dementia and their caregivers, and to build community capacity to ensure that the highest quality of life is possible while living at home with the disease. Currently, Wisconsin and Georgia have a DCS program. Indiana and Maryland have introduced bills to fund the program, and at least 4 other states are working on it this year. Wisconsin started their program with 3 positions. It proved so successful that their legislature is currently providing funding support for 70 dementia care specialists, including a DCS in every county, as well as several tribal communities. The program's also been highlighted by the Administration of Community Living, a division of the U.S. Department of Health and Human Services. AB 167 seeks to replicate this program in Nevada. In addition to crisis response, the DCS program will work proactively to support people living with dementia and their caregivers, and to build dementia capability within the community to ensure a highest quality of care possible. To accomplish this, the DCS will be embedded in their communities and will provide free information and assistance to adults with memory or cognitive concerns, or who have been given a dementia diagnosis. They'll provide information, education, and support to family members and friends who are caregivers of people living with memory loss or dementia. And they'll help develop dementia-friendly communities where people living with dementia can remain active and safe, and caregivers can feel supported. And they will train resource navigators, and here in Nevada that would be at the Nevada Care Connection or our Aging and Disability Resource Centers. They'll also be able to train county and municipal office staff to be more dementia capable. The bill seeks to fund 3 DCS programs through the Aging and Disability Services Division. ADSD will use a request for proposal process to designate local government agencies or nonprofit organizations that will hire the DCS and implement the program. The bill also includes funding for training and program evaluation. And with that, Madam Chair, I'll go on to summarize the bill, if that's all right.
We don't have an amendment on the bill, is that correct?
That's correct.
Everyone has had the opportunity to read the bill. It's been on the agenda for a little while, so I don't think we need to summarize the bill. Can jump into questions unless Ms. Peterson has some additional testimony.
At this point, Madam Chair, with your permission, I'd like to turn it over to Ms. Amy Peterson.
Okay. Ms. Peterson, please remember to state your name for the record, and you may begin when you're ready.
Thank you. Good morning, Chair Peters and members of the Assembly Health and Human Services Committee. For the record, my name is Amy Peterson, and I'm a resident of Boulder City, Nevada. I'm a volunteer for the Alzheimer's Association, where I facilitate 3 caregiver support groups. I present community educations, and I advocate at both the state and federal levels. As a former full-time Alzheimer caregiver, I would like to thank Assemblywoman Claire Thomas for sponsoring AB 167, which would establish a dementia care specialist program in the state of Nevada. My journey with dementia Specifically, Alzheimer's disease began when my 47-year-old husband, Drew, had to quit flying as a commercial pilot due to his early symptoms of dementia. Initially, we dealt with forgetfulness and poor judgment and his immense frustration at not being able to do familiar tasks. As Drew's disease progressed into the moderate stages, I was faced with numerous situations for which I was really unprepared. I tried to read as much as I could about Alzheimer's disease, but day after day I would feel blindsided by the very real dangerous situations that would arise. I was a wife with human emotions, caring for my husband with unpredictable behaviors, feeling very isolated from family and friends who didn't understand, and my life with my husband was slipping uncontrollably through my fingers. As his disease progressed, there was that day that a very angry Drew took the car and he drove over 60 miles towards our former home, 400 miles away. He didn't have his wallet or his cell phone or a coat in the freezing temperatures, and I was about ready to call the highway patrol when he returned home 3 hours later, only because he couldn't get the heater in the car to work. About 6 months later, we had another problem with the car keys. I wouldn't let him drive, and so he angrily took his bicycle for a ride that resulted in an accident and a call from the hospital ER. My gentle husband never had a violent bone in his body until the night he did, and he got violent. The unexpected encounter almost resulted in a 911 call, but I was not seriously injured, and I knew that he would not remember what he had done, and he couldn't help what he had done, and a trip to jail would not accomplish anything. In time, I would realize what events triggered his outbursts, and eventually I would learn not to escalate the situation, but not without a great deal of angst and tears. My husband died a few years ago, but the memories of the daily caregiving struggles remain, and my story is not unique. Members of my support groups share similar frustrations and concerns, and we brainstorm ways to identify triggers and how to de-escalate behaviors. We discuss medication management, kitchen safety, removing weapons from the home, when to take away the car keys, how to secure the doors to discourage wandering. Unfortunately, most of these conversations are in response to situations that have already occurred, adding immensely to the frustration of the care partner or the caregiver. Sometimes the situation will reach a level that requires help from first responders, and it results in the person with dementia being subdued and removed from the scene, confused and frightened. The caregiver, usually a family member, is bewildered, guilt-ridden, and fairly devastated. You know, when my father was diagnosed with a heart attack, he was given a plan for treatment, a diet, and an exercise program. When my husband was diagnosed with Alzheimer's disease, he was given a drug that might work, and we were sent on a journey through the unknown. The Dementia Care Specialist program would have been a huge, very valuable resource to me, and to help guide us, making the journey easier to navigate. So I urge you to vote yes to pass AB 167, which will offer support to those diagnosed with Alzheimer's or other forms of dementia and their family and caregivers, and it will increase awareness and aid in the formation of dementia-friendly communities and result in dementia-capable organizations. Thank you very much for your time and consideration.
Thank you, Ms. Peterson. I think most folks, maybe I'm speaking out of turn, but I know personally that dementia has affected our family in a variety of ways, and can appreciate the struggle families go through and trying to figure out what the best thing to do is with their loved ones and with their family and their resources. We're going to move on to questions, if that's okay with you, with the presenters. Great. Are there questions from the committee? I have a couple on a list, but please wave me down if you have others. I'm going to start with Assemblywoman Taylor.
Thank you, Chair. And thank you to my colleague and to those who presented such an important issue. My family's also dealing with this right now, so it certainly couldn't be more timely for me. My question, and just because you mentioned Medicaid and the savings that the state could acquire, is this just for Medicaid recipients, a position such as this?
Madam Chair, through you to Assemblywoman Taylor.
Please go directly to
Thank
the
you.
members, if you would.
Assemblywoman Taylor, no, this would not be specifically for individuals who have Medicaid coverage. It's insurance agnostic. It's just to help families who are dealing with a loved one with dementia.
Okay, thank you. Chair, follow-up, if I may? Thank you very much. And you mentioned 3 positions to start and gave the example as to why 3. Do you have any designs on where they will be located as we begin this?
For the record, Charles Duarte. Assemblywoman Taylor, no, not at this time. I think an RFP process would appropriately identify those communities or county organizations that would be best to host these individuals. And so, you know, my hope is that that need will be expressed through proposals that are submitted to Aging and Disability Services as a part of that process.
Okay, thank you very much. Chair, I'm sorry, one more follow-up, if I may? Okay, thank you. You mentioned the RFP process, so there's funding, but the fiscal note is neutral on this.
Again, Charles Duarte for the record. Assemblywoman Taylor, there is no fiscal note attached to it, but there is an appropriation request that we'll be making for $532,000, which will cover 3 positions plus some administrative costs.
Okay, thank you so much.
You're welcome.
Thank you, Chair.
Thank you for asking that question. I dove into the fiscal note here and took me a minute to find that in the bill. I do assume you've had or are having conversations with the chair of Ways and Means and our House about that appropriation request as the bill moves through.
For the record, Charles Duarte, yes, we'll be having those conversations.
Fantastic.
Thank you.
Assemblywoman Gonzalez, I have you up next.
Thank you so much, Madam Chair, and thank you so much for the presentation on a very important issue. I was just wondering, you talked about like the need, and so I was just curious, like what is currently happening? If you could just walk me through, let's say if I had a family member who needed these services, like where are they going now? Thank you so much.
For the record, Charles Duarte, Assemblywoman. So a variety of things can happen, and it really depends on the ability of the family to identify resources. But one of our hopes is that they'll first turn to the Alzheimer's Association, because at alz.org, there's a host of free webinars, information, trainings, and access to support groups like those that are facilitated by Amy Peterson down in Las Vegas. And so that's a great start. The other point of contact could be through our Aging and Disability Resource Centers or Nevada Care Connection. But quite often what people experience is they don't know where to go, and they don't know who to talk to, and they don't know where those resources are available. And so the Dementia Care Specialist Program would not only be there to advise families that are asking questions about dementia, but also to provide those types of trainings and resources to folks. So they'll serve as a guide for individuals who need access to information and education, either through our Aging and Disability Resource Centers or through our county organizations, local government entities, nonprofit organizations. They'll be embedded in communities and training different organizations within those communities to be more dementia capable and dementia knowledgeable, so that they could serve as extensions of information for families that might contact them asking for help.
Thank you so much. And then I just had a follow-up question. I know this is not the money committee, but in your appropriation, is that also including to build the facility? I missed that part, I'm sorry. Or that's just staff, and then you would move to the facility?
For the record, Charles Duarte. Assemblywoman, there is no funding to build a bricks and mortar or facility. The RFP process would identify a local government entity or nonprofit organization that would host these positions. So the funding is primarily for 3 positions, dementia care specialists. And as I said, there is some funding in there for administrative costs associated with hosting those positions, but that would be a cost somewhat borne by the local government entity or the nonprofit that wants to have a dementia care specialist on site and available for their clientele.
Thank you for the questions. Assemblywoman Newby, I have you next.
Thank you, Madam Chairwoman. In section 1, subpoint 2, subpoint A, it speaks of crisis intervention services, and I'm just wondering what that would look like on the ground in terms of crisis intervention.
For the record, Charles Duarte. Assemblywoman Newby, that's a really good question. I'm glad that you asked that. So these positions are going to be 40-hour-a-week positions, and so they aren't going to be 24/7 available for first responder rollouts to an emergency situation. The idea and the way that they're utilized in Wisconsin is that they'll be, first of all, training first responders in how to deal with dementia behaviors and how to appropriately deal with those kinds of situations. In addition, what they'll do is they'll work with first responders, including APS workers and EMS workers, on follow-up crisis stabilization plans. And so the idea would be to identify some community resources or even family resources that can be brought to bear to help stabilize the situation for that individual so they could remain at home. And then the third piece would be family education and providing that information to the family, as well as support services, making those available to the family to help maintain that person safely at home. In talking with some of the staff at Wisconsin DHS, what they talked about was some of the things that Ms. Peterson mentioned, and that's things like kitchen safety, making sure that there's a medication list available for EMS when they show up, things like removing weapons, taking keys away when it's appropriate for them to stop driving. So these are the types of things that a dementia care specialist would help educate and proactively prevent any future crises from occurring. So they'll be involved in crisis stabilization after the initial event, and then in crisis prevention in the future going forward for those families.
Thank you. I think some of us are surprised by just the lack of available services in our state so far. It's thank goodness for the internet, I guess. Assemblyman Nguyen, I have you next.
Thank you, Madam Chair. And I want to echo your sentiment that you said earlier, along with Assemblywoman Taylor. I too have both of my grandparents, my maternal grandparents, suffer from this before their passing. And this bill, thank you, Assemblywoman Thomas, for bringing this up, because it definitely highlight the need that we have in the state and just overall around this issue. And what Ms. Peterson recounted her story just kind of triggers a lot of painful memories that our family had dealing with this particular incident. It's almost 20 years ago, but it's still fresh in my mind of the struggle that our family had in terms of knowing how to deal with all of that. And that leads me to my question in terms of language access. And I think that's critical, especially with the diversity of our state. In that time frame, my grandmother lost her pretty much vocabulary. She was a proficient English speaker, and then all of a sudden she can't speak a word of English anymore. And so that was difficult to find caregiver that was able to help, as well as educational materials, because there might be support on what and when and where, but in terms of adding that cultural and language layer onto it, that was another difficult steps. So I didn't know if the plan, I know that there was 3 staff involved, but I don't know if there's plan to address that issue with language access as well as educating cultural communities on top of this particular disease as well. So I would love to learn about that. Thank you.
Thank you. For the record, Charles Duarte. Assemblyman Nguyen, it will be a part of that protocol of cultural diversity and communication because, again, we do live in an increasingly diverse community, and I'm a native Hawaiian by blood, you know, and so I'm a transplant from the great Hawaiian diaspora to Nevada. But yes, the answer is yes. And the other thing that we can do, and it's a resource that's available right now, but will also be available to the dementia care specialists, is our 24/7 helpline through the Alzheimer's Association, where you can speak to a licensed clinical professional any time of the day, and it's available in almost every language. So that's an available helpline that the DCS or dementia care specialists can help access if they don't speak someone's native language. We have been involved in a significant amount of outreach as the Alzheimer's Association to communities of color and other diverse communities to try to expand our educational opportunities or expand their educational opportunities. And we have a very robust program of outreach to Chinese, Vietnamese, and ethnic Koreans that are part of the Alzheimer's Association chapters in Northern Nevada and Southern Nevada. So we do have resources available. Whether or not the DCS is going to be multilingual or not, I think is really going to depend on the individual they hire. But hopefully they will look for somebody who has those capabilities. And as I said, there are resources available through the association in different languages.
Quick follow-up, Chair. So thank you for that. That's really good to hear that there is already a language line available. I would just love to see the perhaps the bill language could maybe add a component of language access to ensuring that what you said earlier on the hiring process, as well as the intent to ensure that we don't leave these communities behind, not just the API communities, but other communities in Nevada that need access to these readily available resources.
For the record, Charles Duarte, again, thank you, Assemblyman. I'll work with the bill sponsor, with Assemblywoman Thomas, on that language.
Perfect. Thank you very much. Thank you, Chair.
Thank you for that question and suggestion. Are there other questions from the committee members? Seeing none, we can move on to testimony. Thank you so much to our presenters. I'll ask you to take a seat in the audience, and we can ask folks who are in support to please come up to the tables. I will start here in Carson City, and similar to the last hearing, I am not limiting testimony today to 2 minutes. Please share your thoughts, and you may proceed when, remember to state your name though for the record. You may proceed when you're ready.
Holy cow.
Unlimited is subjective there. Go ahead when you're ready.
2 minutes for me could be a lifetime. I'm in support of AB 167 for obvious reasons. I think I testified last week about my mother's own dementia experience. And one thing I'd wanted to recapitulate what we just heard, 50,000 diagnosed people with Alzheimer's or dementia in Nevada right now is an undercount. That's less than 2%. That's like too good. The real number for lifetime prevalence is 11% for men, 19% for women, times our 3 million population means we're somewhere between 300,000 and 600,000 Nevadans might actually test positive were they to come to comprehensive screening. So the 3 designated dementia care specialists would be an incremental good start. I can actually see a day where we'll need 500 because I started thinking about caseloads. You're talking about 50,000 identified people today. 3 people would be trying to each manage over 16,500 patients each. impossible. If you think about in mental health, our case managers are overwhelmed with 80 to 100 of our mentally ill people. With dementia, we're talking about people not just at the beginning of the continuum, classic Alzheimer's that we heard from Ms. Peterson starting in the 40s. We're talking about a range of conditions that run through the entire lifespan. And it isn't that aging causes dementia, aging causes opportunity for vascular dementia, for consequences of diabetes, for infections, for a variety of different factors to come together and produce a neurocognitively disordered individual. And for those of us who have lived with these people, you don't see it coming until the day some milestones reach. For my mother, the milestone was a woman with an MBA forgot to file her quarterly income tax report. She had never done that for 77, 78 years. Now she misses her estimated quarterly and realizes the next cycle she never paid the last one. That was the first tip-off. She no longer could manage her financial affairs. And we had already had a discussion at some point I would take her car keys. And when that decision was reached was when she had described driving from her home in Roseville to Sacramento to see a doctor, and she got lost in Sacramento, but had presence of mind to find a fast food place, go in, get a milkshake, sit down, collect herself, and call for help. So, I mean, you don't quite see dementia creeping up because it's insidious. It's different from delirium, where it's day and night by the hour, and you can see that difference. So I'm completely in support of AB 167 with the warning, the baby boomers, okay, boomer, we're going to break the bank in the next 10 to 20 years. There's a lot of us. We're pushing. We're in this population. You're starting with 3, planned for 50, planned for 500 over the next decade or two. Thanks.
Thank you. And that was Barry Cole for the record. That's okay. We've got you. Thank you so much. I don't see anybody else in Carson City coming up for support testimony today. So we'll go ahead and go to Las Vegas. We have someone at the table. Please remember to state your name for the record. You may begin when you're ready.
Thank you so much. Before I officially get into it, I apologize for the confusion earlier. I'm far from an expert. It's just, you don't get to talk about this issue very much, so I'm very happy to be able to share my story with y'all. Good morning, Chairwoman Peters and members of the committee. For the record, my name is Sean Navarro. I live in Assembly District 34, and I'm the son of someone living with dementia. I want to thank Assemblywoman Thomas so much for bringing forth this bill, and I want to share with y'all the story of my family. On December 15, 2017, our lives were changed forever. That was the day that my father, Robert Navarro, at the age of 64, was diagnosed with Lewy body dementia. He went into work like he usually did, and he took a fall outside his work. And since then, he's never been the same. My dad was a pharmacist for over 20 years. He worked the graveyard shift at Rite Aid. Often, he would man the busy counter by himself. He would travel long distance for work. He'd work 12-hour shifts, sometimes 2 weeks in a row without a day off. He was an amazing provider, and he was fiercely independent. Almost overnight, all that changed. And now he needs 24-hour care, and he remembers his old life, and he struggles with this new reality and what's happening with him. One night, he asked my mom if she thought he was stupid. In our case, we're very fortunate. He has insurance, he has the means to pay for his care. Due to his good union job, he has a pension, and he has the support network of our stereotypical large extended Mexican family. But most of all, he has my mom, Belinda. Saint Belinda, we call her. There's a term they use in the medical field for the caregivers of people with dementia, the invisible second patient, because these caregivers forego their own needs and dedicate everything they can to the person with dementia. My mom is the epitome of this. She's with my dad all day, every day. She worries about the day when he might be too much for her to take care of, and she may have to sell her home to pay for their care and put him in the care facility. She prays that she doesn't die first so that she can be there to take care of him. I asked her, when I told her I'd be speaking today, I asked her what she wanted to say, and she said, you miss the simple things of life. The thing that she misses the most is being able to go to the grocery store without worry. For me, personally, the toughest thing is that I'm an organizer. I organize the Las Vegas DSA among other groups. I spend all my time trying to help people, but I can't help my dad. I'd like to think that together we can make a brighter future. But for my dad, the future he faces is very tough. The reality is that he's going to get worse. And all we can do is be there for him the best that we can. That's a very hard reality to live with. and I carry that with me every single day of my life. This bill would bring much needed education and support to the families dealing with this awful disease. For too long, people with dementia have been treated like they're invisible, like they simply didn't exist, even by their own family members and friends. People will come by and they'll visit my dad, and they won't address him personally, like he's not there. They'll address my mom and they'll whisper in hushed tones, "How is he? How's he doing?" Imagine how you feel experiencing something like that. You know, people are very well-meaning and they try their best to understand, but they can't. You have to live with this every day to truly understand what it's like. Many of the family and people impacted by dementia, they say they feel shame. The reality of dementia is that it's a very brutal disease to live with. And it can be it's not pretty to live with. And some people just simply don't want to deal with that reality. And they try to hide these people away. Well, today I'm here to say I'm not hiding and I'm not ashamed. It's far past the time that we end the stigma associated with dementia and bring this issue to the light and give these people the help they deserve. I'm very proud of my dad. Despite the disease, he's the same person he's always been. Smart, funny, kind, kind of an a-hole to be honest, but he's our a-hole. He just needs a little bit of help. And so I come forth to you today to ask for that help. On behalf of all Nevadans impacted by this horrible disease, please pass this bill. Thank you all so much for your time. God bless. Thank you.
Thank you so much for your testimony. It reflects very similarly to the story of my family dealing with Lewy bodies dementia. Are there other folks in Las Vegas that would like to provide support testimony on Assembly Bill 167? Seeing none, I'd ask BPS to check the public line for support testimony on Assembly Bill 167.
Callers, if you would like to testify in support of Assembly Bill 167, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 014, you're unmuted on our end and you may begin.
Good morning, Madam Chair and committee members. My name is Russell Rowe, and I'm testifying on behalf of UNLV and its president, Dr. Keith Whitfield, who regrets being unable to participate in today's hearing. With a PhD in lifespan developmental psychology, Dr. Whitfield has been studying cognitive aging for over 30 years. He is a member of the National Advisory Council on Aging for the National Institute on Aging, and most of his $20 million in grant funding over his career has been to study health and cognitive aging in African Americans. There is a great need for services for, as well as research into, the causes of Alzheimer's disease. In 2020, it was estimated that in Nevada, 49,000 people have the disease, and by 2025, there will be 64,000 people with Alzheimer's disease. A 31% increase, one of the highest projected increases over that period. Alzheimer's disease is the 5th leading cause of death among people 65 and older. In 2021, family members and friends provided over $271 million in unpaid care for people with Alzheimer's disease. At UNLV, we have one of the most prominent researchers of clinical studies on Alzheimer's disease and other outstanding faculty who study aging. But at this time, we do not yet have a specific academic program that focuses on the disease. It would be immensely beneficial to the people of Nevada to establish dementia care specialists as outlined in AB 167. Both academically and as president of UNLV, Dr. Whitfield stands ready to offer the university's assistance and resources in support of this objective. Thank you very much.
Thank you for your testimony today. BPS, is there anyone else on the public call-in line that would like to provide support testimony on Assembly Bill 167?
Chair, there are no other callers to testify at this time.
We'll move on to opposition testimony. Is there anyone in Carson City who would like to provide opposition testimony on Assembly Bill 167? Seeing none, is there anyone in Las Vegas who would like to provide opposition testimony? BPS, is there anyone on the public call-in line that would like to provide opposition testimony on Assembly Bill 167?
Chair, there are no callers at this time.
We'll move on to neutral testimony today. Is there anyone in Carson City who'd like to provide neutral testimony on Assembly Bill 167? Seeing none, is there anyone in Las Vegas for neutral testimony? Seeing none, BPS, is there anyone on the public line who would like to provide neutral testimony?
Chair, there are no callers at this time.
With that, we'll go back to the bill sponsor and Mr. Duarte, if you have closing remarks.
Thank you, Madam Chair and members of the committee. For the record, again, my name is Charles Duarte. I would just like to thank you for the opportunity to discuss Assembly Bill 167 today, and a special thanks to Assemblywoman Claire Thomas for sponsoring this important piece of legislation, and I look forward to working with you on a go-forward basis. So again, thank you very much.
Thank you, Madam Chair. And I really do appreciate you listening to our stories, because these are life experiences that we shared today with you. And I'm hoping that you will consider AB 167 and vote in the positive in passing this out of committee. Thank you.
Thank you so much for bringing the bill and for the presentation. And thank you, Ms. Peterson, if you're still in Las Vegas, for your story and sharing with us today. We'll go ahead and close the hearing on Assembly Bill 167 and go to our last item on the agenda, which is public comment. I will be moderating public comment. We like to stick to 2 minutes for consistency across the board. I've obviously have some discretion in that, but we will go ahead and start today in Carson City with public testimony, public comment. Is there anybody in Carson City for public comment today? Seeing none, in Las Vegas, is there anyone who would like to provide public comment today? Seeing none, BPS, is there anyone on the public comment line who would like to provide public comment today?
Chair, the public line is open and working. There are no callers to testify at this time.
Thank you so much. We'll go ahead and close public comment. A note for the committee, please leave these binders at your desks. You may take whatever you need out of the binder, but the binder should stay in the committee room so that we are at least reducing our plastic use in here. Are there any questions, comments, final thoughts from the committee before we adjourn? Seeing none, have a safe weekend out there. Our next meeting will be on Monday, the 13th? The 13th at 1:30 in the afternoon. See you then.